day, ma'am. I am Angeline Reyes, your student nurse from Pamantasan ng Linsod ng Marikina. Assess the patient physical abilities, the abilities and understand to follow instruction, the patient degree of comfort and discomfort during moving. The patient weight, the availability of equipment and other personnel to assist, assistive device that will be required, hindrance to movement such as IVs. Medication the patient is receiving, assistance required from other healthcare personnel, the functionality and availability of the support. Before entering the patient room, we need to always check or to perform hand washing to prevent the spreading of microorganisms and prevent the cross-contamination between the healthcare provider and the patient. Next is we need to check the patient chart to know the baseline of the patient. Good day, ma'am. I am Angeline Reyes, and we are. I'm Ezra Luis. Everything will happen in this room remains controversial between us and the medical team. Okay. Ma'am, are you okay in this room? Or ma'am, do you want me to close the door? No, it's okay. Do you want to go to the restroom first? No. Are you okay in this room? So, let me know if you are ready. I'm ready. In moving up in bed, you need to place the head part of the bed um, as low as the patient can tolerate. So assume that the bed is adjustable, and then assume that I adjust the bed. And then raise the bed appropriately for the patient comfortability. And then lock all the wheels of the bed and remove all the excess pillow, and then place one pillow in the head part or headboard of the bed to protect the head of the patient in moving up. And then for the patient who is able, instruct the patient to grasp the upper part of the bed together with her feet and then her arm. So ma'am, can you move independently? Grasp upper. And then for the patient who is partially able, we need to assess first the weight of the patient. For the patient for those patients who weighted 200 or less than 200 pounds, we can use friction reducing device with 2 assistants. And then for those patients who weighted 201 pounds to 300 pounds, we can use friction reducing device with 4 assistants. And then for those patients who is weighted more than 300 pounds, we can use transfer lift or air lift. And then after assessing the patient, flex the knee, the hip, and position the feet of the patient, and then place the arm of the patient across to her body or to her chest, and then ask the patient to flex her neck during movement and head off in the bed surface. And then you can use again friction device. And then for self, I must face the direction of the movement. So assume the broad stance and 1 foot forward and then 1 foot backward, and the weight should be on the forward leg or forward foot. And then lean the trunk. So assume that I have a partially able patient. Lean the trunk and toward the hips, and then flex the hips, the knees, and the ankle, and then tighten the gluteal part and then the abdominal, as well as the leg and the arm, and form one back leg and then one front leg, and shift the weight forward in during movement or moving. So for the patient who is unable, you can use a ceiling device or ceiling lift with a supine position, and then after that we must always ensure the patient safety and then patient comfortability, and put a positioning device in the patient head or hips if needed. And then put her arm across to her chest, and then pull the patient at the side of the bed. If you have assistant, you must or you can pull the patient together at the count of 3, and then elevate the rails of the bed. So assume that the bed has a rails. So place one pillow in the head of the patient after turning. And then place two pillow in between of the leg of the patient to support the upper upper leg of the patient. So roll in and position the patient in proper alignment, and then check for the spine of the patient, and leg rolling is used to um, clean the patient body and then place or replace the linen of the bed. So the nurse should flex her hips, knees and ankle, and then place her hand over the patient, and then count 1 to 3 in rolling to position the patient in lateral position. While rolling, ensure to protect her head, back, and the lower extremities of the patient. In leg rolling, I must position myself first and then my patient properly before doing any movement. In sit on the side of the bed, patient should be on a lateral position. So ma'am, I will be positioning you in lateral position. The lower leg is on the side of the bed, and then stand beside of the hip and the face of the patient, and then one arm is around the neck of the patient and one is on the thigh and the knees of the patient. So 1, 2, 3, I will stand. So that's breath and then coffee. First, we will do the waist to turn in bed and get out the patient. First, the patient right abdominal or chest infusion. Flex the knees of the patient, and then split the wound by holding left arm, and then put a small pillow against the infusion, and then turn the patient to left with right feet and hand grasping the side rails. So assume that this bed has side rails, and then instruct the patient to push the hand or to push the hand against the mattress to help her to come in sitting position, and help the patient to come a sitting position. And patient with left abdominal perform the same procedure and split right arm to right side, and that's it. Next is three-leg exercise. So, ma'am, do a dorsiflexion and follow me. Dorsiflexion is like this. Foot pointing upward, and in the other side of your feet, do it. Yes. As well as plantar flexion, foot pointing downward, and that's right. Um, so put your feet on the ground. So flex and extend your knees and pressing back of knees into the bed while doing dorsiflexion. So ma'am, raise your feet and then your foot, one foot pointing upward, and then your stable leg and extend the knees of moving leg. So ma'am, place your knees upward and then as well as on the surface. Yes. And do it on the other side of the leg of the patient. Next is deep breathing. In sitting position, demo how diaphragmic exercise to your patient. So ma'am, place your palm into your rib cage and then inhale and hold it in 2 to 3 seconds, and then exhale through your mouth. And then ma'am, continue it until your maximum chest expansion. Ma'am, can you do it by yourself? Okay, that's good. Thank you. First, we need to assess if the patient has orthostatic hypotension and ensure if the patient is dressed and wear a footwear. So this is a footwear. I will get it. This is a footwear to walk, and apply elastic stocking if needed. So help the patient to sit on the side of the bed at a minute until the patient feels secure. So for the patient who is able, encourage the patient to ambulate herself and walk beside the client with the same speed and same size of step. So ma'am, can you walk independently? So, walk. And for the patient who is partially able, use walking device or transfer belt, and place your arm or hand at the back of the patient and grasp it and walk behind the patient. And for those patient who is unable or unstable during ambulating, you can use wheelchair to ambulate the patient. Next, we will be doing the transferring the patient from bed to chair. First, assemble the things that we will be using. First is the chair. So assume that this is a wheelchair, and then the footwear and bathrobe and the gait belt. So assume that this is a gait belt. Before doing movement, assess if the patient has a hypo or orthostatic hypotension. So lower the bed as lowest position so that the patient can reach the floor. So assume that this bed is adjustable, so lower it. And then put a patient in a sitting position and help the patient to wear a bathrobe. And as well as the footwear. So next is put a gait belt along to her waist, and then fasten it and ensure that it will be locked so that we ensure the patient's safety. So ma'am, can you put your arm around to my shoulder, and then I will put my arm over the shoulder or neck of the patient to help her in standing position. So ma'am, I will count 1 to 3 and then stand. By the way, place your foot forward, 1 foot forward, your strongest foot, so that the patient can help, and then you and your patient cannot out of balance, and to ensure the patient's safety. So, ma'am, stand in the count 1 to 3. 1, 2, 3. And then put the patient and turn your body, and ma'am, can you sit on the chair? So 1, 2, 3. After in the sitting position, or after transferring the patient into the wheelchair, ask the patient to move or push her body backward. Ma'am, push backward to avoid dropping, and then lower the plate of the wheelchair and put her foot or feet on the foot plate of the wheelchair.